Okay, good afternoon, everyone. It is 12 noon, and thank you very much for joining us for our first of two COVID weekly media briefings. I think I see a few mics that still need to be muted just for the opening remarks here. If I think Andy and Matt Latour. Oh, Matt's got his off now. Thank you so much, folks. Okay, so welcome to Tuesday, January 12th, and very pleased to have such a great turnout again today. It's been a very busy couple of weeks. So we're thrilled to have joining us several of our elected officials. Today we will have some remarks from Board Chair Andy Mitchell, the Mayor of Selwyn. I understand Chief Laurie Carr is with us as well from Hiawatha First Nation. And also MP Mariam Monsep is hoping to join us. MPP Dave Smith will be joining us. The County Warden is here with us, and Mayor Diane Therrien. So with that, I will kick us off with our acknowledgement of the beautiful lands that we are fortunate enough to live in. And with that, we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Michi-Saagiig territory and in the traditional territory of the Michi-Saagiig and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. So moving on, I will now invite our board chair, Andy Mitchell, to share some opening remarks with us. So please go ahead, Mayor Mitchell.
Thanks, Brittany. Unmistakably, Ontario and the Peterborough area are facing a significant health crisis. The facts are clear. People are getting sick in large numbers. Our hospitals are filling up. Our ICUs are reaching capacity, and large numbers of Ontarians and Canadians are dying. New cases in Peterborough were almost 2.5 times more in the days after Christmas than in the days before. To do nothing further in response would be a serious abdication of our collective obligations. Each of us must take personal responsibility to adhere to public health measures. The paramount public policy at issue must be how to keep each other safe, not whether measures disrupt our daily lives. It is clear from what happened during the holidays that although many Ontarians worked hard to observe the public health guidelines, some did not. Please remember, COVID-19 does not spread without person-to-person contact. And the more contact there is, the more COVID-19 will impact our community. The current situation likely leaves the government with little choice but to take additional measures. New guidelines and restrictions should be driven by the data and focus on the significant causes of transmission. Measures need to be implemented, such as paid sick leave, that encourages people to stay home when they are sick, and others implemented to mitigate economic impact. New and existing rules will require increased enforcement if they are to be effective. The impact of not undertaking new measures will be to extend the crisis and will likely permit further increases in community spread. As a community, it is important we step up and take the measures necessary to protect our families, our neighbors, and our community. Stay safe, be well, and be kind. Thank you.
Thank you, Mayor Mitchell, for starting us off today. So to give us a sense of what's going on and our most recent statistics, we've got Dr. Salvatierra on the line who can share the current situation with us. Go ahead, Dr. Salvatierra.
Thank you so much, Brittany. So it's been 6 days since we last met, and I'm pleased to provide you with an update. As of 4:30 p.m. yesterday, we were managing 51 active COVID cases. That's down from 89. So the decline has certainly been welcomed, but we are still concerned given that this is double the number of active cases we had just 3 weeks ago on December 23rd. In total, we have reported 437 cases since the pandemic began, and that's increased by 38 since our last media scrum. My team is following 144 close contacts, again, slightly reduced from last week by about 33. And our community remains at 5 local deaths from COVID-19. As far as our new cases reported by date, for the month of December, we reported a total of 137 cases. So far in January, we are at 90. Keep in mind that we have not yet reached the halfway mark this month. So this does give you an indication of the continued increase in the pace of new cases as we continue to surge through our second wave. As far as exposures, the close contacts continue to be the highest source of exposure. So those close contacts, those social gatherings, close to 65% of all cases so far are in close contacts, people that we have deemed to be high risk for the most part. And community spread is sitting at about 22% of our cases. So still, I think a good reminder that there is COVID out there, both in the community and among your beloved friends and family members. Last week, I just want to commend actually the team, the case and contact management team, for the amazing work they're doing. They are doing their best to connect with as many high-risk contacts as possible so that they can be isolated before they become contagious. And I think this is a really good reminder for everyone in Peterborough that you should be downloading and activating your COVID alert app on your phone so that you can be notified instantly if you may have had a high-risk contact with a positive case. Next slide, please. Our gender breakdown continues to skew slightly more in favor of males than females. As far as our age breakdown, we are still seeing that the largest proportion of our cases, 150 of them, are in the 20 to 29 age bracket. As far as testing in Peterborough, we hear reports from our paramedics that North Crest continues to be busy and approximately 40,000 local residents have been tested to date. 600 more new residents tested since we last reported. And we are consistently testing between 500 and 600 new residents each week, in addition to those residents who are getting routine testing because they work in long-term care or they're visitors. As far as outbreaks go, we have 3 outbreaks currently in progress. One of these includes a new outbreak declared at Fairhaven yesterday morning. And so far there is only 1 case in a staff member. My team has just begun that investigation and we are awaiting test results to determine if there are any more cases linked. Both of the congregate setting outbreaks are stable at this time. As far as our hospitalizations, the cumulative numbers since last March show that we've had about 4% of our local cases who have required hospitalization. And if we go to our map with incidence rates, I think some hopefully good news is that in the last 6 days, our case incidence rate declined from 47 cases per 100,000 to 33 cases per 100,000. That, as I said earlier, that's certainly welcome. And our rate continues to be much lower, almost a fifth lower than the cumulative provincial case incidence rate. So in general, Peterborough, we're doing well in comparison to other parts of the province, but we certainly need to, we can't let down our guard, and there's still work ahead for us. So I am hoping that the increased frequency of these media scrums will allow us to provide the media and our community with timely information on both the status of our outbreak here in Peterborough, as well as the progress on our vaccine rollout. We want the community to hear as soon as possible about the public health measures, how well they're working, what else we are asking from you. We certainly see that it's community health protection. It's a collaborative effort that's going to make the difference. So for example, last week, we identified the urgent need to prevent crowding at our outdoor ice rinks and toboggan hills. We are recommending that people wear face coverings when participating in winter outdoor activities, as sometimes the 2-meter distancing is hard to maintain. When I was out walking this past weekend, I was happy to see the safe use of our parks and our outdoor settings occurring. That was very encouraging to see. As I've already indicated, we saw a drop in the number of our daily new cases on Friday and a reduction in high-risk contacts. That was certainly a much-needed break for our case and contact management team. But as of this morning, we have already 9 new cases being reported to us today. So clearly, we're not out of the woods. It's certainly great to see testing numbers continue to increase at both our North Crest and PRHC testing sites. So hats off to all of our community paramedics and our hospital staff and family doctors who are ensuring that people can get same day or next day testing. And that's really important. Our new cases are still being fueled by high-risk contacts, close contacts. So it is important that we remind everyone that at this point, no indoor gatherings are permitted, and we are to limit our contacts to just our household members. If you are providing an essential service and you are working outside of your home, you must actively screen for symptoms every day. And if you are feeling unwell, you must isolate and get tested. I continue to call on our local employers to support their staff with active screening and by providing paid sick time so that staff do not come to work sick. I would just like to tell you a little bit about vaccine rollout at this point. I'm not sure, Brittany, if you have another slide that could be projected, but I do want to let the media know that over the weekend, both General Hillier and the Premier, and as well as several ministers, met with our medical officers of health and hospital CEOs to advise us that they have set a new target. This slide, I think, speaks to the targets that were set last week. You will see there's a Peterborough at the bottom. We're in yellow. That's our daily our daily incidence rates, and you can see those 4 other, the Toronto, the Windsor, Peel, and Ottawa, showing you why the province did choose earlier to focus on high incidence rate areas for vaccine delivery. But now, as of Sunday, we have learned that by February 15th, we are to have all residents, staff, and essential caregivers in all long-term care homes throughout the province immunized with at least the first dose of the COVID vaccine. So there's Peterborough in yellow showing you how we compare, but we too now by February 15th must meet that target. And given the worst case scenarios that are being shared today, with over 2,600 long-term care residents deaths being projected by February 14th, this makes absolute sense. So to this end, in order to reach this target of February 15th, we are convening our Peterborough Interagency COVID-19 Vaccine Planning Team. We understand that the first vaccine to be delivered to Peterborough will be the Pfizer vaccine, and this is the one that we will begin using, taking out through mobile teams into our long-term care homes. We are preparing these teams to be able to support and work with our long-term care facility partners to ensure we meet our target. We have 8 long-term care homes in Peterborough. We met with them on Thursday. And as soon as we receive confirmation of our vaccine delivery date and the supply of vaccine that we can expect, we will ramp up our planning in order to ensure both a high and comprehensive uptake of the vaccine so that our residents are protected. Although, and here you see the overall vaccine rollout strategy which has been shared by General Hillier. And just a reminder that we currently are still in phase 1, where we have very limited supply of vaccine being projected. So although we are currently not planning on rolling out the vaccine to our community until phase 2, which begins in the early spring, we have already begun the task of public education to help our residents make informed decisions about the vaccine. Last night, I was able to attend a vaccine information session that was hosted by Hiawatha's Chief, Laurie Carr, for her citizens. And I understand we have lots of interest in the community for our next session being planned, which is now planned for Friday. I heard last night from our primary care providers, both our family doctors and our nurse practitioners, that they are eager to begin sharing vaccine information with their patients. And that is music to my ears. I think the more people who are informed, we'll see more people making good choices and choosing to get the vaccine. And we are currently aiming for 75% of our population, our eligible population, being immunized by September 1st. Clearly, there is still lots of work ahead, and I look forward to sharing those details as they become available. Our current deadline, besides the February target for long-term care, is a requirement from the province to have our plans submitted by the 3rd week in January, and it's wonderful to know that we have the support of the county and the city and our community partners to ensure that those plans are ready and that they are, they are at a high likelihood of being successful. So I'll end there and give the floor back to you, Brittany. Thank you.
Great. Thank you very much, Dr. Salvaterra. So now we have a chance to hear from our local elected officials, and I would like to start with Chief Laurie Carr, if she has any remarks to share. If anybody has video that they would like to turn on their cameras, I can certainly spotlight you for the presentation, but audio is just fine too. So go ahead, Chief Carr, if you've got any remarks to share.
Thank you, Brittany, and thank you, Dr. Salvaterra. I just wanted to comment that last night we did have our information session on the vaccine, And it was well attended by our community, and we do greatly appreciate the information that was provided, and we hope that our citizens will use the knowledge that they have now and work towards making that choice for them to get the vaccine or not. And I just wanted to say that so far, our community has done well. We have remained, and I always touch wood when I say this, we have remained COVID free at this time, and have the majority of our citizens following the health guidelines. And of course, we are promoting those and asking people to follow the guidelines and the ones that we have put in place too for our community. So I just wanted to say thank you to everyone for the support that we receive outside of our community, and for everyone making the choice, the responsible choice to follow the guidelines to keep us all safe and keep our numbers low in the Peterborough County area, or at least lower than other regions that we see. So miigwech, and thank you.
Thank you, Chief Carr. So great to have you joining us. I see our MP, Miriam Monsef, is also on the line. Miriam, if you have some comments, feel free to share them. And again, if you have video, I'm happy to put you up on the screen. Go ahead.
Thank you, Brittany. I do have video. I don't know if you can see it though.
Don't see it yet, unfortunately. It's just
do you want to go to Dave and I'll try to fix my video?
Sure. So MVP Dave Smith, I understand you're joining us today, which is great to have you on. Please go ahead if you've got some comments. And I can put your video on as well. Oh, I think we see you now, Miriam. Tell you what, why don't, since we've got you up, why don't we quickly start with you, Miriam, and then we can, let me just get the spotlight happening here. There we go. And now we can, and then we'll move on. Okay, go ahead. Great to see you.
Sure thing. Thank you so much, Brittany. Hello, colleagues. Bonjour, Anin, salam alaikum. I'm on traditional Mississauga territory in my home in Peterborough, and I want to start, as always, by thanking everyone at Public Health, our frontline workers, particularly those working in facilities who are currently experiencing an outbreak. Our thoughts and our hearts are with you, and we are here to support you in any way that you feel is reasonable and needed. Let me also acknowledge all the teachers and educators, students and parents who are adjusting to an extended online work. I know my nieces are restless and miss their teachers, and I know that it's not easy for anyone, that it's frustrating at times, but we are going to get through this together. And I have some good news on the vaccination procurement front. As you know, Canada has agreements in place with 7 different vaccine manufacturers, most of whom their products are under review by our independent regulators in public health. 2 of those vaccines were approved last month to be safe to use in Canada, Moderna and Pfizer. Moments ago, the Prime Minister announced that the Government of Canada has reached an agreement with Pfizer to procure an additional 20 million doses of the Pfizer vaccine. This brings Canada's total of secured, safe vaccine doses to 80 million, which means Canada is on track to provide every Canadian who wants a vaccine with both doses by the end of September. The delivery schedule for vaccines is also published so that Canadians can see for themselves the shipment dates, the number of doses to be received by provinces and territories over the next 2 months, and so that provinces and territories themselves have the vaccines themselves and the information they need to get the shots in the arms as quickly as possible. Currently, the Government of Canada has distributed just under 50,000 doses of vaccines, including 196,000 here in Ontario. Of that 196,000, about 133,000 have been administered. That's a rate of approximately 11,000 a day, or just under 80,000 a week. We appreciate everyone working so hard to ramp up the efforts and the province for their important work on that front. We anticipate another 137 doses will be distributed to Ontario this week, and at least 80,000 Pfizer doses a week for the rest of this month. These vaccines will save lives, but we still have work to do to limit the spread of COVID, to keep each other safe. So please listen to our hardworking public health experts who have our best interests at heart, and let's look forward to a better spring, a better summer, and a much better fall. Thank you, Brittany.
Thank you very much, Miriam. And thank you for those uplifting words. I think we all need that right about now. Okay, so I see MPP Smith's assistant on the line and wonder if MPP Smith is able to join us to share some remarks. Sydney, do we have an update?
Hello, everyone. I apologize. MPP Smith is caught up in a caucus call right now, so he isn't able to provide remarks. I would just add that if anybody needs anything from our office or any media have any questions, I'll put our email in the chat box below, and you can feel free to reach out. Thank you.
Okay, great. Thank you very much for that. Okay, so we'll move on to our municipal partners. I'll start with County Warden J. Murray Jones. Did you have any comments that you would wish to share today, or just like to be available for questions?
No, I'll just be very brief. I thank Miriam for that good news. I think we all needed that shot in the arm. Peterborough County, we're certainly doing our very, very, very best to show some leadership and obey the rules. All of our townships are doing the same. And I always like to give a shout out to our paramedics who are on the front lines doing all kinds of great things. We don't take you for granted, that's for sure. And our public works people who have to get the job done as well. So to everybody, let's keep reminding ourselves that we are in this together and we're going to come out smiling at some point. So let's keep a good attitude going. Thank you.
Excellent. Thank you very much, Warden Jones. Okay, and so now we have the Mayor of Peterborough, Diane Therrien. If you've got some comments for us, Mayor Therrien, please go ahead, and I'm happy to put any video on if you'd like.
Yeah, thank you very much, Brittany. Not too much to add that hasn't already been said. I know that it's, there was a lot of optimism in 2020 about 2021, and that's for a lot of us has sort of quickly faded. But I think the updates that we heard previously from MP Monsef, and as much as I know that the Premier and MPP Smith have been working on this file too, as much as there are still dark times ahead, there is light at the end of the tunnel. And we do need to be thinking long term, as well as in the short term, continuing to abide by the guidelines that we are very familiar with by this point. Again, not just for ourselves, but for our neighbors and friends and family, and all of those workers who have no choice but to be out, be on the front lines. Those of us that are able to work from home, we are encouraged to do so. It's not been easy for anyone. We recognize that for sure. And we are all in this together, to take from J. Murray Jones, who he believes in that strongly, as do I, and we all know that. And this is a time where we kind of need to lean on each other, I think, more than ever before, because there still is a long road ahead of us, and it's not going to be easy. It hasn't been easy for 10 or 11 months now, and that's just the reality. Things kind of suck, but we can get through it. We will get through it. We get through dark times by supporting one another, by leaning on each other. So we need to continue to do that. And so, yes, I'll be around for questions, and that's just what I wanted to say. So thank you very much.
Lovely. Thank you very much, Mayor Therrien. All right, we appreciate everyone's comments. So now we will open it up to our media colleagues. And if you could just let us know who your question is targeted towards. We will start with Matt Latour from Oldies and Freak Radio. Matt, if you've got any questions, please go ahead.
I've got some questions for Dr. Salvatierra. The first one has to do, I know we heard a lot of talk the last week or so about curfews and whatnot, and it sounds like that's not going to happen here in Ontario, but we're seeing it happen in Quebec. What do you make of kind of these two provinces going back and forth on whether or not something like this would work?
Well, Matt, I haven't had the benefit of being briefed by the scientific table. There is a provincial scientific table. Public Health Ontario also provides much of the scientific advice, so the evidence-based advice for public health measures. I haven't seen the evidence to support curfews. I think really what we want is reduced mobility. So people staying home, and I would hope that the Premier and the Cabinet are carefully considering the evidence to ensure that we can support people to stay home and get better adherence with those public health measures. The only way to stop this virus is to stop people from moving around. So I expect that we'll hear later today what the Cabinet and Premier have decided as far as which public health measures they are prepared to put into place to help us turn this thing around.
Perfect. And my second question has to do with the COVID-19 vaccine. I saw earlier this week that the province is now allowing pregnant or breastfeeding women to be vaccinated against the virus. Why was this something that had a delay?
Well, pregnant and breastfeeding women were not included in the clinical trials for both the Pfizer and the Moderna vaccine. And so, I mean, we know a lot about vaccines and which would suggest that this one should be safe. But because we don't have data, it's really impossible to make an evidence-informed recommendation. So for that reason, children, pregnant women and breastfeeding women are not included as eligible for the vaccine. However, we also are aware that there are pregnant physicians and respiratory technicians working in the ICUs with COVID positive patients, and they have been advocating for access to the vaccine. So for those populations, for the pregnant women, definitely, the advice is that they need to have a risk-benefit assessment done, that they should be counseled by their healthcare provider to make that decision, and that if they decide to get the vaccine, that they can in fact get it. But they are not a population for which we are recommending wide access. And right now, the recommendation that I gave last night to Hiawatha First Nation citizens is that women who are of childbearing age who get the vaccine should plan not to get pregnant for 2 months following the completion of their second dose. That would be the advice, and for women who have other reasons to be immunized, they need to have that conversation with their healthcare provider.
Perfect. And my last question has to do with the arrival of the Pfizer vaccine locally that you mentioned earlier. I know when it was first announced that the Pfizer vaccine was approved, you mentioned there wasn't really a whole lot of deep cold storage spaces here. Has that changed?
Yes, it's changed in that the hospital not only has an ultra cold freezer, but is getting a second ultra cold freezer as backup. So we anticipate that PRHC will be our vaccine storage site for the Pfizer vaccine. We ourselves will have a freezer for the Moderna vaccine should we get Moderna, but we know now that this is not expected anytime soon. We know that it will be Pfizer coming to us, and as of Friday, we now have very clear protocols as to how to move the vaccine into long-term care and how to protect it so that we can ensure that people who are being immunized with the Pfizer product are getting full potency and full benefit from the vaccine.
That's it for me. Thank you.
Great. Thank you very much, Matt. And thank you, Dr. Salvatierra. So Taylor from Peterborough this week, if you've got any questions for Dr. Salvatierra, please let us know. Go ahead.
Hi, yes, thanks. Just for Dr. Salvatierra, When it comes to vaccination of long-term care homes that's happening, I guess over the course of this month and next, are homes that are in outbreak going to be prioritized over homes that are not in outbreak?
The current advice is to not go in and immunize during an outbreak, Taylor, but instead to wait for outbreaks to be under control. And instead, we have already prioritized our long-term care homes, and the fact that there have been COVID outbreaks in the past would certainly make a long-term care home higher priority. So we do expect to review the list of long-term care homes with our planning table at our first meeting on Friday. We will have representatives from long-term care homes there, and we will certainly listen very closely to ensure that the order of priority that we undertake meets their needs, and that we do it in a very collaborative way.
Okay, and just for clarification too, long-term care homes, does that include congregate care settings like the 2 that are currently in outbreak?
No, it does not. If you look at the deaths in Ontario, because the vast majority of deaths are occurring in long-term care homes and high-risk retirement homes, it really is these senior congregate settings that are being prioritized by the province. We don't expect to get to the adult congregate settings until later. In fact, we haven't had written word yet as to when we might expect to be in those settings. First, right now, the first priority that, and we have full agreement between all the partners, is that by February 15th, we will have our long-term care homes, their residents, and if we have enough vaccine, their staff and essential caregivers, we will have them immunized with their first dose by February 15th, I'm sorry.
You mentioned long-term care homes as well. Are hospital staff included in that as well?
So hospital staff are second priority, very close behind the long-term care homes, because as I said, I believe I said, we have healthcare providers such as people working in the ICU, where they're taking care of COVID positive patients. They're doing aerosolized procedures, so they themselves are at high risk, and because they are critical to the care of these COVID patients, they will be prioritized. So the province has created a hierarchy for prioritization of hospital healthcare staff and workers. The hospital is currently reviewing this with their staff, and they will have a prioritized list so that if any vaccine becomes available in the course of immunizing our long-term care, that they will get access. So for example, what's been happening to date is that if there's a clinic for long-term care staff and caregivers being held at the hospital, and there are some no-shows, or there is some leftover vaccine at the end of the day, that will go to the high priority healthcare workers in the hospital.
Okay, just my last question here, just in regards to, on the topic about the congregate care facilities, is there any update on cases coming out of the Stewart homes and community living situations?
Yes, in that both of those outbreaks are stable at the moment. So that's a good sign. I can't tell you when we will be able to declare those over, but the good news is that there are no new cases to report today.
That's great to hear. Okay, I think that's everything for me. Thank you so much, Dr. Salvatierra. Much appreciated.
Okay, thank you, Taylor. Okay, so Joelle Kovac from the Examiner, please go ahead and ask your questions.
Okay, for Dr. Salvatera, I have some questions of clarification about the timeline that you were talking about regarding vaccine. So it seems to me that you said long-term care, is it staff and residents who would be the first priority at long-term care by the 15th of February?
So it's residents, staff, and essential caregivers in that order.
Okay, that's helpful. And the Pfizer vaccine is coming first, you said. Did you say by the 3rd week of January?
No, unfortunately, Joelle, we have not had written confirmation yet on when to expect our shipment of Pfizer vaccine or how much to expect, but we were told on Sunday at our meeting with General Hillier that all public health units should receive Pfizer vaccine by February 1st. So that's for our planning purposes. We are using the February 1st date as when we need to be ready to go. However, we are still awaiting written confirmation.
That helps tremendously. Now, those first doses of vaccine, I'm presuming that those are going straight to long-term care. Those are, because that's the priority.
Yes, they are going, we will have our mobile teams ready to go, and the long-term care homes as soon well, actually as of last Thursday, the long-term care homes are already planning, so they will have their lists of approved caregivers, their staff, their residents. They are currently they've been given consent forms, so they will need to have signed consent for anyone receiving vaccine, and we will begin to book those people into schedules once we get a better idea of when we will be able to go there with vaccine.
Okay, that's helpful. And the final thing I need to really understand is I understand that there's priority populations. You talked about that, how it would be First Nations and hospital workers. But did I understand that for the general population, for the rest of us that are, you know, in line, it would be by spring that you could expect to get that first dose?
So currently, because of vaccine delivery, currently Ontario's phase 2 doesn't begin until sometime between March and April. By April, the projected doses, and maybe that has changed, and we heard from our MP that more vaccine has been secured. So, but as of last week, the projections for April were that we would have 5 million doses coming into Ontario each month, and that's at the point where we expect to be doing mass immunizations, starting with essential workers, adults by age, starting with the older adults first, certainly the at-risk populations, and by the end of the summer, seeing that open up to all adults who wish to have vaccine.
Okay, and the last thing that brings up for me is, are children ever going to be eligible to receive these vaccines? My kids are desperate to know.
The studies are being done now, Joelle. So we should have some information maybe in time in the summer to know whether or not we can put vaccine into arms of children as well. But right now, as you know, we just don't have the data.
Okay, that's very helpful. Thanks, I'm done.
You're welcome.
Thank you, Joelle. Okay, I see Paul Rellinger, and then following Paul, we will get Jessica Nisnik to ask questions. But go ahead, Paul, if you've got some questions.
Thank you, Brittany. You can hear me okay, or?
Yep, you sound fine.
Okay, good. I'm never quite sure. Sorry about that. Yeah, a couple things for Dr. Salvatera. We're talking about a lot of talk about the vaccine for long-term care homes, retirement residences, which are separate. Where do they fit in? I haven't heard anything on that yet.
Well, Paul, my hope is we can do them as soon as we've got more vaccine. I would like to get them done by February 15th, frankly, but I have been told by our Associate Deputy Minister that we may not get enough vaccine here in Peterborough to do them at the same time that we do long-term care homes. So we might have to wait for subsequent shipments of vaccine to be able to do the retirement homes. I also want to do the seniors congregate settings as well. So, I've been in those settings. I certainly understand we have lots of very frail and vulnerable seniors living in these situations, and I do want to get them immunized as soon as possible. So stay tuned. We may know more once we see the delivery written notice confirming how much vaccine is coming into Peterborough.
Okay, and just to confirm, you said there's 8 long-term care residences within our catchment area?
Yes, in the county and in the city, there's a total of 8 long-term care homes.
And this is, as the media tends to do, a totally unfair question. Do you know how many residents roughly that represents?
Roughly, I believe it's about 2,000 residents.
Okay.
Roughly. But Paul, let us confirm that. We'll get off once we complete this media scrum, we'll get back to you with a confirmation. I've seen the numbers, I just don't have them in front of me.
Sure, that'd be great. Thank you. Another matter, and I know it's not quite within your purview, but we've heard a lot of talk about ICUs being overwhelmed at capacity, particularly in and around the Toronto area, and talk of possible patient transfers to hospitals outside of the Toronto area to accommodate needs as they arise. Again, recognizing that you're not in charge of PRHC, but I'm just trying to see if you have any insight into any aspect of that at all.
No, I'm sorry. You'll have to speak to PRHC. And I just want to add, I'm sorry, Brittany and Jessica, I have been called to an urgent meeting with the Chief Medical Officer of Health that started 2 minutes ago. But I do want to give Jessica a moment to ask questions, and then I'm going to have to sign off.
Okay, thank you. I'll let Jessica step in.
Go ahead, Jessica.
Thanks, Dr. Salvatierra. This is really beating a dead horse, but we continue to get calls about incidents at workplaces and their bosses not telling them, and outbreaks at workplaces. You've said this before, it's not up to the employer. You hope that they tell their employees, but they don't have to. People are asking why that is. Why do employers not have to tell their employees? Because then they take to social media, and then things just get out of control because they've heard someone at their work has it. Literally calls every day. Dr. Salvatierra.
Well, Jessica, I think we need to be clear on what is a workplace outbreak. And we do not have a workplace outbreak unless there is potential for that transmission has occurred in the workplace. And the moment that we have any doubt or that may have happened, because we do a risk assessment, we would be working with the employer and the other employees. We would declare a workplace outbreak, we would post it on our website, and we would do everything that would be required, including potentially doing public communications with the public if we felt people were at risk. I think what you are hearing is that people are getting COVID and they may work somewhere. We would, when we do our contact investigation, if there are high-risk contacts in the workplace, we follow up. But there may be absolutely no link at all with the workplace. The person may not even have been in the workplace during the time that they were contagious. So people just need to put a little faith in public health to recognize that if we identify them as a high-risk contact, we will be in touch. And if they have any concern about this and they work, they should be downloading the COVID-19 Alert app. That's something everyone can do. Use the app, and that way there should be no doubt that if you have been exposed, that you will be notified even before we can get to you by phone.
Thank you. You know, you said that before. It's people, not places, but it doesn't seem to be getting through. One last thing, I know you have to go. Why, people keep asking me, why don't employers have to tell their employees? Have to. I know you suggest they do, but why don't they have to? Is it a privacy issue?
Well, it is a privacy issue. There still is stigma that we see with diagnosis, not for all. For some people, you know, they're on social media telling all their friends, but for others, there is the potential of stigma. And so unless we need to, my duty as a health information custodian, and this is legislated duty, I must protect the privacy of the people whose personal health information I have in my custody. And so I have to have a reason to expose someone potentially to a privacy breach. And I'm not going to do that unless there is a public health benefit to doing it.
I wish we could run that on repeat every day. Thank you so much. People, I don't know if they just don't watch our channel or what, but every day, and I don't understand. So thank you so much, and thanks for your time today.
You're welcome. I think people are curious. We're social and we're curious, and it's really about wanting to know rather than needing to know. And that's a distinction that we are trying to make and drive home. But thank you. With that, I'm going to sign off. Thanks, everyone.
Thank you.
Thank you very much, Dr. Salvatierra, and thank you everyone for joining us. So we will be meeting again this Friday. Jessica, I'll make sure you get a chance to go first next time if you're able to join us. And thank you for being a part of today's weekly briefing, or I guess bi-weekly briefing. And we will check in again with you on Friday at noon. Okay, thanks all. Take care.
Thanks, Brittany.
Thanks, Brittany.